Thank you everyone for joining us today for our first webinar in a series that we are doing with our partners at McKinsey. I am Julia Ray-Fulbert, the Chief Operating Officer of Chiefs for Change. First, I just want to say an enormous thank you from all of us for your leadership and your service to the students and families of this country during this incredibly challenging time. Today marks a series of webinars that we'll be doing over the next few weeks to try to provide you with as much support as possible in your reopening work. We will also have a separate series of webinars that we are doing for our state leaders in partnership with the Council of Chief State School Officers and with McKinsey. We are incredibly excited and grateful to be able to have our partners at McKinsey in this work with us, and incredibly grateful to our Chief in Residence, Pete Gorman, as well. Just take a look now at the agenda slide for today. We are going to do a quick introduction and overview of our webinars. We're going to spend some time talking about lessons learned from international school reopenings. A number of systems have now been open for some time, and there's a lot that we can be learning from this in our planning. And then we're going to talk through how to solve some of the capacity constraints and building a schedule for this new normal that we're all going to be existing in as we go into this next school year. Today's presenters. So I am joined by our incredibly talented colleagues at McKinsey, Leah Pollack, Samvitha Ram, and Jimmy Sarakasanis, along with our Chief in Residence, Pete Gorman. And I'm going to turn it over to Pete, who's going to talk to you about our webinars that we'll be embarking on with you over these next few weeks.
Great, thanks, Julie, appreciate that. So this webinar is actually a follow-on to a series that we've done for about 8 weeks, 9 weeks now. And in doing those webinars, we've had a series of discussions with the Chiefs members, amongst the Chiefs members, but we also had an initial webinar with the folks from McKinsey where they shared some really helpful information with us. This is the next in that series. As Julia said, today's practical planning for the fall and reopening. And on July 9th, we'll move on to our next one about testing your reopening preparedness. In particular, we'll touch on transportation much more in depth as a major issue. And we'll also do some activities of modeling what the days would be like for individual students working through the entire component of a day. We'll help you with that process, show you some ways to do that, to do tabletop activities and things like that that you can do to prep your team. And then our final webinar in this series with our partners at McKinsey will be how to monitor and evaluate. It'll be the pieces where you're getting ready now for the final steps of this. And it's important that we say monitor and evaluate because we know with the ever-changing conditions that we are living with right now, you're going to constantly have to be tweaking. Even though you want to put out clear plans, you're going to have to be ready to tweak them on a dime. So for today's webinar, before I hand it over to our friends from McKinsey, please take advantage of using the chat box. It is really helpful if people put forward concepts, thoughts, and ideas in the chat box that they're thinking about, that they're looking for. But the first activity we want you to do with the chat box is, will everyone please go to the chat box? Will you please share with us your name, your district, and the position that you hold? Just so everyone else on the call can know who's joining us today. So name, position, and your district, if you could share those three things. And then through the course of the webinar, take advantage of using the chat box to share with people questions you have, thoughts, successes, areas you'd like us to dive deeper on. I'll be monitoring the chat box for the group, throwing some things out periodically to the rest of the group to help as well. And with that, then I'm going to turn it over to Leah Pollack, who is a partner with McKinsey, who's going to get us started with this work. Thanks for joining us and keep sharing that information, folks. I'll monitor the chat box. Leah?
Great. Thank you, Pete and Julia. Hi, everyone. I'm Leah Pollack. As Pete mentioned, I'm a partner with McKinsey in our Washington, D.C. office. And over the past few months, I've been working on COVID as part of our public sector practice, in particular on reopen. And so what we're going to spend time today is really talking about what are some of the lessons that we can learn from international school reopenings, and have a discussion at the end about what feels applicable, any questions that you have. And then I'll hand it to my colleague Sam, who's the project manager for our team, to talk more in depth about the 100-day work plan and some deep dives on specific areas around constraints and building a schedule. On the next slide, what we wanted to tee up here is when we look across countries that are opening schools, what are some of the big takeaways? What are some of the common themes that we're seeing? The first one is that we are seeing many countries moving towards reopening schools. So as we're seeing across the US, school systems around the world have been shut down with COVID. And so as we move to reopen, that leads us into the second point, which is that as schools are reopening, one thing that is common is that school does not look the same. The in-person learning experience looks different. How it's different varies quite significantly country to country. And so what we want to do is share what some of the similarities and differences are, and just share some of the takeaways of what we're seeing around schools reopening. The next point is in terms of, we looked at, as schools reopen, what does it mean in terms of the number of cases? And it's Sam, if you just go back a slide, the number of cases and what's the overall trend on case count, and is there any type of correlation there? And then the last 2 points that we'll talk about are in terms of lessons learned, both more successful examples of reopening, as well as some challenges that countries have faced. I would say in terms of real strengths, it's where we've seen countries and districts do broad stakeholder engagement and frequent communication, as well as this fifth point in terms of really thinking about what are the potential pitfalls? What are some of the scenarios that you might face, whether that's localized outbreak, and we'll talk in depth about kind of some of the examples of resurgence planning and what we're seeing schools do when there's a confirmed case of COVID. So on the next slide, we'll jump in. This is just a map to say, when we look internationally, both you're seeing kind of globally schools being closed and affecting over 1 billion students around the world. And what we're also seeing is that school systems are moving towards reopening, with many starting in April and obviously continuing now through June. And so on the next slide, we'll talk, what we wanted to share is some specific examples looking at countries of just what the reopen has looked like. And a few things here that are interesting are to say that when you look across countries, there really is not one standard approach to reopening schools. So you take Denmark, and Denmark's an example that really has been widely shared and celebrated and looked at in terms of lessons learned. And I think what's really interesting about Denmark is Denmark actually identified schools as the very first thing to open. They said, we're going to open schools first, and then later restaurants, retail, other sectors, but schools first because we know it's so critical to childcare. You take, and then in particular, but they only opened schools for elementary age children. You look at South Africa, they took a different approach. They said, and they're opening right now, they're in June, but they said, we're going to start with transitional years, or the 7th grade and 12th graders in terms of reopening. So a bit of a different end of the spectrum. In Israel is another example where they said, we're actually going to prioritize kind of in the middle of those two extreme examples, and we're going to prioritize grades 1 to 3 as well as 11 and 12. And then again, that you have the example of Taiwan, which actually never closed schools. So again, lots of different examples. But what's interesting is to say what's common. One thing that is common when we looked across all of these is that they all did some type of screening for students upon arrival at school. And so temperature checks is something that we're seeing kind of as being quite common. You also, many saw staggered arrival time for students. I think that what's interesting is in terms of hand washing guidance, this has been quite common. In Denmark, it's actually, they put a big emphasis on both the hygiene, washing hands, as well as on the reduction in classroom size and doing pods. And they said, if we can really get that right, the hygiene and the small class size and then the pod-like classes, we're actually not going to require masks for students or for teachers. So that's one example. I think, if you look at some of in addition to the health procedures, what we talked about a couple of examples, what you also see is in terms of capacity and operational changes. Here you see you're seeing many schools looking to reduce classroom size and going about that in different ways. Some examples of physical dividers, I think, again, the Taiwan example is interesting because they didn't close, they didn't reduce classroom size, but they have made adjustments within the classroom and within cafeterias with physical dividers. And then also we're seeing adjustments in terms of transportation, reducing the capacity in terms of buses. So again, just at a high level, some examples of both health procedures as well as the capacity and operational changes. On the next slide, Sam will talk through this third point in terms of, a lot of questions around what's the impact of opening schools in terms of the total number of cases. I think the key point here is that in many countries, you're seeing schools open along with other sectors, or schools opening later than other sectors. So again, this graph is from the Center for Global Development. It's not meant to say when schools open, kind of what's the impact of school opening in terms of new cases. It's just at the point in time that schools open, what do we know in terms of the overall trend line? And I think what's interesting though is when you look at this, is that for many countries that were in the process of reopening, you see when they opened schools, the trend line continued on a downward trend. There are some notable exceptions, South Korea, Israel, and we'll go into Israel in more depth. But overall, the trend is that we're not seeing a significant resurgence in cases as schools reopen. We did want to share with you because we thought it would be helpful, because that last slide has a lot of different data on in a lot of countries, just to pull out two of the lines and say, kind of, if you look at Israel and you look at Denmark side by side, what can we learn from these two countries in their experience reopening schools? And I think it's a pretty interesting examples. The first is on Israel. So Israel reopened schools in May, and as I mentioned before, brought back a mix of grades in terms of grades 1 to 3, as well as older grades 11 and 12. What and we'll go in depth in terms of kind of how they actually reopened, but what they saw is that after reopening, there actually was an increase in the number of cases in Israel, and they have had to close a number of schools. Currently, they're actually, if they have a confirmed case in a school, Israel, their approach is to close the entire school. So currently, there are about, at least 100 schools and kindergartens that are closed across Israel, and we know about 20,000 students that are in a 14-day period of home isolation and quarantine. On the other example is Denmark, and Denmark is one of the first countries, is the actual first country to really reopen schools. And they announced their reopening in April, brought back elementary age students, and they have actually seen, even as they've brought back kids in middle school and high school, they have seen a continued decline in terms of the number of new cases. So two different examples in terms of one seeing a resurgence, another not. And we'll go a little bit deeper in terms of what are some other kind of lessons learned, both from the Israel example as well as the Denmark example. On Israel, so what's interesting about Israel is they announced on a Friday that schools could reopen 48 hours later. So there was a very short amount of turnaround time from when the kind of reopening guidance was issued to when schools reopened. And so this first point in terms of the guideline strategy and the timeline, there was a lot of confusion around what the guidance was, and there was a lot of changes that even happened over the weekend. There's an article that we read saying that a principal shared that even the night before the schools reopened, the guidance was changing every hour. So again, late breaking decisions, late breaking guidance, and a lot of changes. Also in terms of capacity and resources, there was very little guidance in terms of how to actually adjust the physical infrastructure or the staffing needs to meet the new expectations in terms of smaller classroom sizes or other adjustments that they were expecting schools to make. So it was really left up to the schools to make those adjustments, and again, led to a lot of confusion. Another, in terms of responsibility enforcement, they asked families to take the temperatures of students, to do some of that screening, but there wasn't follow through in terms of actually ensuring that families were doing that. And so again, quite a bit of confusion on whether healthy students were going to school and then the sick students were staying home. And so being clear about the responsibility and actually following up to ensure that was occurring. And then also we thought, some additional factors is when the schools were reopening in Israel, it was incredibly hot, and asking the students to wear masks proved to be quite challenging because of the heat. And so in terms of, led to a lot of adjustments in terms of the mask requirements, and they faced a lot of challenges reinforcing this policy. So again, some examples of some of the challenges that Israel faced. On the next page, wanted to share some of what worked well, another example of what actually worked really well in Denmark. And this is an example of in advance of school opening. And as Pete mentioned, we're planning to go more in depth on this type of model in the next webinar, but really thinking through each step of the process from the student's perspective. So again, this is an example within an elementary school of having students dropped off at staggered times, immediately having a hygiene protocol in terms of washing hands outside of the school before even entering the school, moving into actual school time, a lot of hygiene precautions throughout the day with hands being washed every 2 hours, a lot of regular cleaning of surfaces, some time spent in the classroom, also a lot of emphasis on time being spent outdoors and engaging and learning outdoors. And then also thinking through the pickup protocol. So having parents line up in a distanced manner, students coming out of the school versus having parents go in, and students washing hands again. And then what we thought was interesting is that actually the process goes also all the way to home with the ask that students actually change their clothes at home, rewash their hands and clothing. And so what's interesting also at Denmark is they actually changed their guidance from originally recommending 6 feet of physically distancing to moving that down to 3 feet after they moved into reopening and found that things that things were going well. So just quickly takeaways, I think what we thought, if you look across both lessons from Israel and Denmark, some of the takeaways are just the importance of the engaging and communicating regularly with all stakeholders, students, families, teachers, unions, and also really thinking about the phased reopen versus going from, this isn't a flipping a switch, but what's the process of reopening to really learn from what's working, what's not working, and a bit of that trial and error approach. And then also thinking through the capacity constraints, and we'll spend more time on that in a moment. But how can new space be made available? Who's going to return to school? What is the impact on teachers and teacher availability? So, and helping to provide that guidance to schools. And then also being very clear in terms of responsibility and enforcement. What's being expected? What technology is going to be provided to support some of the expectations, potentially around screening or otherwise? And then also just taking into account the additional factors like heat, the weather, what the public transit requirements might be, and could that potentially lead to mixing of cohorts before you even arrive at school. So again, some of the lessons learned from Israel and Denmark that we hope are helpful to you as you are in your planning process. And then I have a few more slides and then we'll pause and would love to get any questions that you have on the international examples. But this last point we wanted to share is around resurgence. We talked kind of at the beginning in terms of the 5 takeaways that worth identifying from the international examples of schools reopening. And this last one is in terms of really thinking through the scenarios. What could possibly happen when schools reopen? Like this instance of what happens when you have a confirmed case in your community. And what we've seen, whether looking at France or Germany or Japan, Israel, is that this has happened in schools around the world. And how the teachers and families have reacted, as well as governments have responded, has varied. I would say the common theme that we have seen in terms of effective resurgence planning are the first, that just acknowledging that an outbreak could occur and planning for it up front, really providing frequent and regular communication with families, with teachers, with staff, having the tracking and tracing programs in place, and we'll talk a little bit about that on the Germany example. Having clear protocol in terms of closure, and also in terms of testing. What is going to be the responsive and proactive testing when there's a confirmed case? And then this next slide is we thought it'd be helpful just to go deep on 2 different examples of the resurgence planning, just to give you a sense of kind of what is actually happening, some examples of that's happening in schools. So first in France, the example, if a student is showing symptoms, they're immediately isolated, with a mask for children of the appropriate age, with a separate room where they can be supervised before leaving the school. The parents or the guardian are immediately contacted to pick up the student. After they leave the school, the room is cleaned completely and also ventilated to ensure that if another student would need to be isolated in that room, that is possible. And then the student's expected to visit a doctor, where the doctor would confirm that the student actually has COVID or not. Then the expectation is that the school actually contacts the health authority, and that in coordination with the health authority makes the decision in terms of next steps. Does it mean additional students have to be isolated? Does it mean the school needs to be closed? Like, what are the exact next steps are done in coordination with the health authority. Germany is a little bit different in terms of the overall protocol for safety. And Germany is also has a very robust contact tracing program countrywide. It's been a big part of their effort around both contact tracing and testing. And so, but what they've, so they will, if someone has a confirmed case, they will immediately contact anyone that person has been in touch with, and they will go into a 2-week quarantine and also undergo testing. If a student is confirmed with a positive test, the whole class is put on quarantine. If they think that that student has actually contacted more people across the school, then the whole school could be closed for 2 weeks. And in one example, schools in the whole city were closed for a week, just out of an abundance of caution. So again, a couple of examples, and I would just say, a big piece around this is the different uses of technology, particularly on the contact tracing side, but again, in partnership with the health authority often. And then the last slide before we pause, and just would love to hear any questions, is kind of the why we're even talking about the international examples and why we're seeing, why we are seeing so many modifications to schools. And I think it's really because when we look at the academic research, and we look at the the research that's been done, it is not clear yet what the impact is on children. And so, on the one hand, and this is on the left-hand side of the page, you'll see there's reason to be hopeful. If you look at the overall number of confirmed cases, US, China, Italy, less than 2% is children under the age of 18. Also, when you look at the number of severe cases, it's often, the severity in children is much less frequent. But I think the flip side is children and schools have much more contact than you see an adult have on a typical basis. And then we also have the concerns around the multi-system inflammatory syndrome in children, or the MISC, which is unknown what the relationship between MISC and COVID-19 are. And so again, some uncertainty about what is the overall impact. There is a big push to do additional research on children and the transmission, children to children as well as children to adults. But again, yet it's not clear what the impact is, which is why so many health and safety protocols are being put into place as part of Reopen.
Leah, we've got a couple of questions. Susanna Cordova, the superintendent of Denver, asked, in the France example on step 4, is it the suspected student or all students in the class that are tested? Oh, Jimmy just answered. Sorry, Jimmy. Or sorry, thank you. Well, Eric Gordon from Cleveland superintendent, asked about learnings from these countries as far as helping and supporting parents and caregivers while some of the students are back in schools while others are out. Leah, any information on that we can share?
In terms of providing childcare?
Any support, daycare, childcare support, any assistance at all?
This is Eric. It's not even daycare. It's just about how to help parents manage expectations. I think parents, at least in our community, are hoping that all the kids are going back. And so how do we help set expectations and manage expectations if we have to do these phase-ins? Have we learned lessons of what worked well and what didn't work well in these countries to help families know how to navigate that the children may only be back part-time or on certain days or things of that nature?
Yeah, this is Jimmy from McKinsey. First, Eric, thanks for the question. Just to answer the France one for the benefit of everybody, in that step, first the suspected student is tested, and then if that student tests positive, the rest of students are then tested as well as part of the contact tracing protocol. If that student tests negative, then the other students are not tested. Eric, to your question, we do know, for example, in Denmark, there's lots of communication to families about expectation setting, both about the protocols for what to do when students are in school, but then also what they should be doing when they're not in school. We don't have a lot of details on the other part of your question at least as written on caregiving and other supports, but we can absolutely look into that and try to bring that back next time.
Other questions anyone has, if you please put them in the chat box. Scott Murray, Superintendent of Ector County, about how the countries have selected students that serve face-to-face versus virtual, excuse me, a general focus on equal dosage, or is there an equity driver? Leah or Jimmy?
Yeah, I mean, it just like we're seeing systems in the U.S. It's a wide range. Some systems are absolutely prioritizing age. Others are prioritizing vulnerability, or for example, in the UK, they actually never close schools for children of essential workers, and so they there are taking an essential worker, but then an equity lens. So it really is a wide range of trade-offs along the dimensions of need, importance for the economy / age, and equality, frankly.
Yeah. And I would just add on, I think that's one thing that was interesting, that's been interesting to us looking at the international examples, is that the approach in terms of who comes back to in-person learning has varied so greatly. So, you know, Germany prioritized students who were going to graduate so that they could take their exams in person. And then you have, you know, countries like Denmark that said, we actually really want to prioritize the younger grades, because we know that if we don't get those students back, it's going to be very hard for the parents to go to work. So we want to ensure that anyone who's in need of kind of childcare can get their kids back in school. So really a range, I would say. And then in equity, we have seen some examples of that internationally, but it's not always as apparent at a national level how that's factoring in.
Question about sharing about how various countries have socialized their resurgence plans. Did they share proactively, and any better examples? And then we'll move back to the slides and move on.
Yes, I think on the resurgence planning, the one thing that has been interesting is that it seems to, I think, for example, about, the Israel's resurgence plan, I think what's been interesting about their planning is that it's actually evolved as they've gotten more cases confirmed. So now they have over 300 cases between students and teachers who are confirmed to have COVID. And there's been a lot of debate in terms of how to handle that resurgence. Do we close all schools nationally? Do we close schools one by one? But it's been a public discussion in terms of what to do. And this is, again, at a national level on when there's a case, the resurgence of a case. I think, but I would say the common theme, though, that we're seeing is proactively communicating. That the more that there is very clear engagement up front on what to do, how to handle the situation, as well as the training, any training that's needed. So if, about concerns with a student with symptoms, where to take them, that kind of proactive communication and engagement of the community, the faculty, staff, and parents has definitely been more effective with better results. The question on the teachers, I wonder if we should move on to the next section, because that's actually—
Yes, let's move on to the next.
Fantastic. So Leah, thank you for sharing our international lessons learned. I would love to take this group through kind of the meat of our webinar today, which is to talk through how are schools and districts solving for capacity constraints? What are some creative ideas to work around these constraints? And then finally, how do we start thinking about building a schedule for this new normal? So to start, I just want to anchor us back into this 100-day work plan that the CFC team shared, which is an Excel-based planning tool for tracking some of the critical activities that districts need to focus on until the first set of students arrive back on campus. So while the guidance itself is quite detailed, at a high level, these are the 5 major categories or work streams that districts need to be working on before day 1. So these are things like operations, which is procuring the right PPE or deep cleaning classrooms, staffing, which is both a teacher and a staff coverage plan for the fall, academics, thinking through the needs of special populations and their impact on the academic plan, and finally, continuous stakeholder engagement. And I think on the stakeholder engagement piece, it's not just the survey to understand what students, families, and teachers are feeling with fall reopening, but it's also this piece of continuously engaging with them as we think through the key decisions and as we're coming to our final kind of decision steps around fall reopening and what that's going to look like. I think one thing I wanted to flag here is that we think of these work streams as part of a linear plan, and there may be individuals on your team who are working on each of these components separately, but we actually need to bring them together in more of a matrix structure. Each of these work streams impacts multiple stakeholder groups. So think about the fifth grader who's attending her first day at school. Having a fifth grader on campus cuts across operations, which is, what happens, for instance, if they don't have a mask or a face covering and your state requires it? How do you think through the operational planning there? It cuts across staffing and the academic needs. So what is the fifth grade schedule actually going to look like? Special populations. So this might be, this individual student and or her peers. And then finally, the stakeholder engagement piece, which is keeping parents informed about what exactly the schedule is going to look like and what are the key things that they need to be responsible for on the health and safety side. So before we actually talk through some of the specific capacity constraints that districts are facing, this is on a more detailed level, the 100-day work plan and some of the critical activities that need to be done. On the left-hand side, we see the things that should have been completed at this point in the reopening planning process. I think we're pretty much past the 90-day mark for most districts in terms of when this first student is going to come back. So, for example, districts should likely have met with their instructional vendors or tech partners to understand what capabilities they're going to be providing across the different operational scenarios or different classes. They probably also should have launched a survey and or a set of advisory groups with key stakeholders as an input into their planning process. And from what we understand from Julia and Pete, many of you have actually launched your survey already and are either awaiting results or currently analyzing results. So that's definitely on the 90-day side. I think the right hand then shows the upcoming set of actions that districts are going to need to take over the next few weeks. But would love to pause here and do a quick pulse check. Just where are different districts, where are different individuals in terms of the planning process?
And if you could please use the chat box to let us know where you are in that process.
Okay, while the responses come in, I'm going to suggest we keep going and then let's open it up to a broader discussion. So I think from what we've heard in our conversations with districts so far, the biggest challenge that districts are facing right now is how to deal with the issue of physical constraints. And specifically, how do you then move past these constraints and maximize face-to-face learning if that is indeed a priority? So this includes constraints like, the actual limitation of space available, given that you have to follow a 6 feet rule or 3 feet rule, or even some, general notion of social distancing that states might have issued in their education guidelines, as well as teacher availability and teacher staffing. So we've looked further into 3 of these dimensions in particular, which is A, space availability, B, teacher forecast and teacher staffing models, and finally C, the flexible scheduling and how do you build a schedule given, the capacity constraints that you might be facing. So I'd love to spend the next 10 minutes or so sharing some of the research and some of the ideas we've encountered, peppered with some international examples, so what we're seeing from school systems that have already reopened, and then open the floor up to hear from you on what options you've been considering. Great. So let's start with the potential ways to expand the physical classroom space, which I think is constraint number 1. So one is to actually increase the capacity within existing classrooms while still meeting either your state and or CDC's health guidelines. So this could involve something like installing physical dividers or plastic dividers between desks. Another option is to consider additional spaces to repurpose into classroom spaces, whether that's other spaces that already exist within your school, like gyms, cafeterias, the school field, the parking lot, or even find new additional spaces outside of the school campus. So things like community centers or concert venues that are probably going to be quite empty in the fall. The Scottish government actually announced that they would be expanding the physical space available for teaching by taking short-term leases of likely vacant business centers this fall. The second constraint that we've heard a lot about is concerns that the teachers won't return in the fall. And if I'm not mistaken, someone brought that up on chat just a couple of minutes ago, the concern around teacher health and teacher staffing. And some of our district surveys have also revealed that teachers may be hesitant about returning to face-to-face learning in the fall, just given the health and safety component. We know that 18% of teachers nationwide are 55 or older, which puts them in the vulnerable group. So these are all very well-founded concerns. So there's a few options I think we can consider here if teaching shortage is something that you and your teams are working through right now as a potential constraint to fall reopening. So first, we could consider extending the reach of our current certified teachers through, for example, asynchronous model. So this would be where the teacher works with a smaller group face-to-face, while a second cohort of the same class attends through a live recording. Option two is to adjust the responsibilities of our current teachers as well as our current school staff. So could, for example, other school staff that is non-teachers supervise study groups or small group project-based classes? This could add to the teacher capacity. And finally, if both teacher and staff shortages become a concern, so just in general, human capital is a concern at school, then there's already some ideas that have been floating around about increasing the total pool of teachers and staff. So think about the formation of, the Corona Corps, which is something that's been written about a lot lately, or bringing back retired teachers for small group instruction or even remote instruction. And I know Denmark actually implemented something similar. So they recruited recent high school graduates who are on an international gap year to come back to Denmark and provide extra support and staffing support to schools. I think step three then is when districts have their physical capacity worked out, so they know how many students can actually be in person for face-to-face instruction at any given time, as well as the total teaching capacity, there's still the question of how do you match the two? How do you create a flexible schedule that enables students to be in person, teachers, depending on the capacity and reach, how do you match the two to form your ideal flexible schedule? And here we've seen kind of a spectrum of scheduling examples ranging from a really low degree of face-to-face instruction, where, for example, the default could be remote learning and face-to-face activity is only available for certain grades or special populations. And this could be an example of where special needs or vulnerable student groups are prioritized. There's also this middle ground option. So some districts are considering dividing cohorts into this idea of stable groups or pods that move together for classes, breaks, lunchtime, and ideally even transportation. And they have minimal exposure outside of these groups, and that's how you maintain the health and safety of the group. And then there's also a version of the schedule which is, back to normal, and we'll put that in quotes because there's obviously going to be many increased precautions that you take even if the schedule is somewhat similar to normal. So think Taiwan, for instance, which never fully closed, but implemented quite strict hygiene and sanitizing measures. So they had temperature checks and then obviously physical dividers as well. I am conscious of time, and I do want to open it up to discussion very soon. So let me just take you through our last couple of slides. This page lays out different versions of a school schedule or potential school schedule based on the need for in-person learning, as well as the prescription of state safety guidelines. Again, I won't go into too much detail here, except to note that all of the three models you see, whether that's the layer model, the staggered model, or the rolling model, all consider a fixed number of face-to-face learning hours per month, but an additional layer of flexibility that you could consider adding to the schedule is increasing the total number of school days per week, for example, Saturday classes, though that might be a very unpopular option, or increasing, the number of total school weeks in the year, if that's an option at all, which is using spring or winter break for smaller face-to-face classes. And more information on the scheduling models can be found in CFC's policy paper, which is linked here. So in building this new schedule, I think districts and schools are going to face some challenge on prioritizing classes and segments for face-to-face learning, because even with expanding physical capacity, expanding the reach of teachers, and thinking through flexible models, there might still be constraints on who gets to come back and at what times. So one helpful tool for a school or district is doing some version of this prioritization assessment that you see here. And what this is actually just a guideline for choosing which subjects need to be at the top of the list for face-to-face learning. So districts will need to come up with their own set of criteria, but a couple of questions to consider here, which we've laid out, are, number one, how critical is this subject to the student's holistic learning experience? To what degree do they actually need in-person equipment or active teacher interaction? To what degree might it require, interactive peer-to-peer collaboration, if you think of sports sessions, for example? And finally, what might districts want to consider in terms of the extent of future learning that is dependent along the current building blocks of this subject? Again, this is a super illustrative model. Each district will need to come up with their own set of criteria, but it could help prioritize which classes or subjects you bring back. And finally, another layer to consider, and again, there have been a couple of questions about this in the chat as well as offline off of this webinar, but schools are thinking about how to prioritize vulnerable student groups, which may require further in-person support. And we've seen a couple of examples of international school systems actually prioritizing vulnerable groups. So, Israel, for instance, prioritized special needs children or special education children to ease pressure off parents and just provide them the opportunity to come back to school for in-person or face-to-face learning. I'll pause here. This is our discussion section, but before we actually talk through, which topics you found helpful or what might be helpful to cover in our next session, I would love to hear the different models that your districts are currently working through, whether that's physical capacity or teacher capacity. I know transportation is a big issue, which we haven't touched on yet, but is going to be a focus in our next webinar, so we'd love to hear thoughts on that as well.
I believe this is the point in time where we're going to stop recording the webinar and move into just a discussion folks have.